Hi, this is Dr. Rozakis. What I want to do is talk to you about the study regarding epigenetics for eye diseases. Anecdotally, we have seen people have improvement in visual acuity in dry disease, and it was obvious. They volunteered it. We weren't looking for it. They told us. We saw improvements in dark adaptation, improvements in Snellen visual acuity, etc. So now I think the reason that this is happening is because we are resuscitating the cells that are not dead in the macula, the RPE cells to be more precise. So we're making those cells healthy again and the patient sees. Now, this case here is fascinating because this shows a patient who's been injected for 10 years for wet disease. But it doesn't matter if it's wet or not. The incredible improvement in the quality and health of the macula is why this person is reporting better vision. And this person is 94 years old. So when I look at this improvement in the quality of the retina, it is no surprise to me that the dry patients are seeing better. So the study we want to do is to take patients, get a fantastic best corrected visual acuity. Sure, we can do OCTs as well, no problem there. And start them on the program and then recheck their vision at 1, 3, 6, and 12 months. The patient is going to enroll in the study. You are going to provide us your medical record to allow us to pull out of it the data that we need. By doing it that way, we can do this study across the country with any willing provider. So that's one study. Now, the second study we want to do is to see if we can do this. To what degree can we do this? And what I'm talking about here is treating refractory patients. So if a patient is refractory and is not responding to anti-VEGF injections, then add epigenetics and let's see if we can improve the situation. That's a study that has a very powerful endpoint, which is success where there has been no success. And I think that's smart. Suber Wang, who's a retina specialist here in Cleveland, suggested we do it that way, and it makes sense. Having said that, I still don't see why we can't offer this type of care to anyone who's getting injected, because there's a big problem today with the injections. At 5 years after somebody starts getting injected, the patient eventually loses their vision regardless. So the injections are not a panacea. That's a big deal. There's a false sense of security that, well, I can have my injections and keep seeing. No, that's not true. If you have more and more injections, you're going to ultimately still lose vision. So there's a need for something to complement the injections. And if you look at these results in this patient here, we are fulfilling that need with epigenetics because we took a non-responsive case, as shown here, and made it responsive. And this person is 1 year, 1 full year without needing any injection. So it's a duty you have to make this known to your patients with wet disease, in my opinion. If I were your patient and you knew this and I was getting injected and you didn't tell me this, I would really be very unhappy with you for doing that. And that's just my opinion. You can couch it in whatever way. Well, we don't have enough studies. Well, I'm sorry, but I'm getting injected. You have to help me. And if this can help me, if I have any chance whatsoever of epigenetics reducing my need for injections, then it's your duty to tell me that. And here is the second case, the 94-year-old man. This is his only good eye. We put him on our program. He's seeing better, and he's now skipping injections, which is exciting to say the least. His retina looks fantastic. Unfortunately, he has this scar. He's 94 years of age. But look here at the elevation map. Epigenetics allowed us to help this person flatten out, certainly inferiorly. And he's getting better here as well. Unprecedented results. And so again, I think everyone has a duty to make people aware that this exists, and then we can enroll them in a study to see if they too can show improvement. I think that's the mission that we have right now, is to get the word out on this and help. Now, we have seen patients with diabetic macular edema improve. So if a patient is receiving injections for diabetic macular edema, then clearly we need to put them on an epigenetic care plan. There's more reasons to put a patient on an epigenetic care plan beyond diabetic retinopathy or diabetic macular edema. But if your patients have diabetic disease, you should have them talk to us, and we'll explain to them why they can prevent eye, kidney, and heart disease with an epigenetic care plan. There's a reason for that. So send those people over so we will talk to them and explain it to them. Retinitis pigmentosa, what can I say? We had an incredible case of a patient who she lost her ability to drive. Then she could not jog because her visual fields were too constricted. We got on board. We expanded her field so that she could jog again. And then 2 years later, she's driving again. Look, it is what it is. I mean, she's under the care of a top retina doctor in Philadelphia. And, you see that and you can't help but take notice, right? So I would love to see more RP patients to see if we can demonstrate an improvement in their visual field and improvement in their quality of vision. So we're going to do studies on this. The details as to when they're checked and what is checked is something we will explain to you. It's not going to be difficult. But I do love the idea that we're all going to work together to do a study and really get to the bottom of how well this works. Does it work? Absolutely. How well does it work? We're going to figure that out together. And I think your patients absolutely need to have the opportunity to at least make a decision as to whether or not they want to move forward with this type of care. If they don't, that's fine. We could put them into a control group and see how they do over time versus how the ones who get on board do over time. And that's just good clinical research. So thank you for spending the time with me today to learn more about this. I'd love to get you on board. Contact me and let's get it done. Thank you.